All right, colleagues, welcome to the Global Coalition to Address Synthetic Drug Threats. This is Sub-Working Group 3.1, July 24, 2024. I'm Brian Morales from the U.S. Department of State, and I have some announcements to get us started. First, I'd like to begin by sharing that we've had a series of events that have taken place over the past few weeks. You should see on my screen the ISUP 2024 event. This is the International Society of Substance Use Professionals, an event that included participants from all over the world coming together, over 1,000 participants in Thessaloniki, Greece. There were over 30 events, workshops that took place during that week. And it was a great celebration of the field. We come together every year. And so this was the annual meeting of ISUP. During this week, on the 26th of June, we also celebrated World Drug Day. Many of you are do your own activities in your countries. And UNODC launched the World Drug Report on that day. Yesterday, we had a presentation on the World Drug Report and its findings for this year. If you have not had an opportunity to read it, I encourage you to go to the website and check it out. And then we also celebrated on the 7th of July the anniversary of the launch of the Global Coalition. And this Global Coalition was launched through a ministerial meeting. For those that did not participate, it was a ministerial meeting that brought together 55 ministers, over 80 countries and 11 international organizations. And if you'd like to see the speeches that were delivered on that occasion, it was a virtual ministerial meeting. You can find those on our website, or you can also check out our YouTube channel where you can see the videos there. There was also a declaration associated with the launch of the ministerial meeting, and you can also read that declaration on the website. So let me also say that we had another meeting that took place during ISUP, which was a meeting of the co-chairs. We had 30 out of the 40 co-chairs of the Global Coalition that came together. And the goal was to discuss progress, actions, how we move forward as a coalition, what the next step should be for the coming year. And one of the areas that was very interesting for me was the discussion around creating more of a donor coordination mechanism, having other donor countries come together to coordinate what their contributions will be to the international drug control system and how best to leverage each other's interests and strengths. And so we're looking over the next few months to have a meeting organized at UNODC in Vienna, Austria, to be able to coordinate not just with governments, but also private foundations that can contribute to our field. And in addition to this, co-chairs talked about many other issues, including strengthening drug prevention measures, the topic of today's group. And we also launched two big networks at ISUP that are very much in line with the Global Coalition. The first, building off of the recommendations that we all agreed to in May, was the launch of a global recovery network. The idea is to help define the field of recovery, help bring clarity, and help, in addition to the definition, bring more activity, more action on the ground by building a network of ambassadors for recovery and training and technical assistance and mentoring in the development of local recovery networks. If you're interested in this network, please visit the website and please connect your recovery allies and peers to this network as well so they can participate in its activities. And the second network is the Global Women's Network for providers that provide women's treatment and recovery services. Again, this is a network for mentorship, for training, for guidance, for research, for collaboration. If you are interested or know others that are interested in this line of work or know of women's treatment providers, for example, in your country, we encourage you to please reach out. Please share with them information. There's a website where they can also register, and they will be brought into this global discussion in how to better improve women's treatment and recovery services. And of course, we have to celebrate the launch of EUDA. On the 1st of July, the European Monitoring Center on Drugs was transformed into the new European Union Drugs Agency. And so we congratulate EUDA on that launch. We look forward to collaborating and working together over the coming years with their expanded mandate. Now, I want to also share, it's not too late for countries to share with us their different actions that they will be taking with the Global Coalition. This can be adopting a new practice, policy, strategy, regulation, or law, engaging with the private sector, providing financial or in-kind support, hosting a regional or global meeting, expressing interest in the initiatives on our website, or any other activity. So I would encourage you all to take a look at these 6 areas, and please send us your contributions, your plans, your interest as soon as you can. The submission deadline was June 3rd, but we are still accepting submissions by email or by Microsoft Word. No more than 2 pages, please. Let's keep it concise. And you can email your submissions to syntheticscoalition@state.gov. What's the purpose of these submissions? Well, we will first post them on our website, so we'll see what the contributions are of different countries. We will also be looking to extract some of that content for our Year 1 report, which we are in the process of developing. And the plan for today is to look at programmatic implementation and action planning. In August, we'll be focusing on monitoring and evaluation and sustainability. But if you are interested in presenting and have not yet presented and would like to share your country's initiatives, commitments, your plans for Year 2, please reach out to us as soon as possible, because August will be our final sub-working group session. Then we will have in September a meeting of working groups, where sub-working group co-chairs will report to working group co-chairs as we wrap up the meeting schedule. I want to thank you all for your collaboration and your coordination. And now I would like to stop sharing my screen and ask Cyril, before I turn it over to our co-chairs, Cyril, if you could play the video from the Global Coalition meeting so everyone can get a sense of what transpired during that week in Greece. Thank you.
Welcome everybody to the Global Coalition meeting. It's incredible to be here in person. With the pandemic, we all started using screens more and more, and now it's not unusual to have a whole year go by without seeing people in person. But it feels a little bit like Hollywood when you start to see people that you've been seeing on the screen now come to life, and now we're all here in one room. It's quite special. Thank you so much for making the journey.
I can't tell you what a great honor it is for me to be in this room with so many experts from so many different parts of your governments. I am happy to have the opportunity to thank you in person for everything that you have been doing over the past year.
I believe it is important that participant countries reflect on and communicate what their own objectives are as part of the Global Coalition and what they want to achieve over the next 12 months.
I urge us to invest in the hard work of building and supporting capacity in less developed parts of the world. This will require time, building relationships, face-to-face visits, and follow-up meetings.
Every country has challenges, they're just different ones. With synthetic drugs, there are a lot of lessons we can learn from other countries because of their experiences. And no one country can solve this alone. It is a challenge that faces all of us, and whether it's fentanyl or some other drug, in addition to plant-based drugs, we all share the same threat and we have to work together. So our goal for the launch of the coalition last July, which would be 1 year and a week, was to get 50 countries together. We ended up getting 80 countries and 11 international organizations. And now there are 156 countries and 15 different international organizations. And that is because of you all. President Biden has now requested $24 billion just for domestic treatment programs at home. We now have a medical doctor who's the head of the White House Office of National Drug Control Policy. And all of this really is because of the things that you have done.
To keep the momentum going, to make sure that this attention to the change.
The structure created strike a balance between treatment and prevention.
If you put all these intelligence minds together, you can't go wrong here. the International Society of Substance Use Professionals.
The exchange between national chapters is fantastic. But when we come together, there's a magic. There's an energy that happens when people are together in the same room. I would like to formally launch the Global Recovery Network.
Recovery is part of the whole continuum of care, and that's why it's a very important component in this conference.
The Global Women's Network represents one of the first outcomes from the Global Coalition's working group.
Because it gives providers from prevention to treatment to recovery that are working with women a place to call home, a place to find their face, their voice, their like-minded spirits within this larger conference.
So one thing that I think the coalition needs to do is start looking at some of these issues that are challenging us outside the box.
Thank you very much, Cyril. Now I'd like to turn it over to our coaches for today, Carolina Bruce Umada from Chile and Inga Dirasik Fustotir from Iceland. Over to you. Thank you, co-chairs.
Thanks, Brian. Thank you so much. It was a wonderful video and what a wonderful opportunity to meet all our colleagues in Greece. It was like someone said in one of the interviews there that magic happens when people actually come together. And when they come together from all over the world, magic happens for the world. You know, so I think we have a pretty set up agenda for today. So Caro, my friend, I don't have the agenda in front of me, so who is the first speaker?
Hola, muy buen día a todos y todas. Muchas gracias, Inga. No voy a repetir en lo maravilloso que fue poder conocernos. Me gustó la frase que era como estar en Hollywood, ¿no? Que podíamos ponerle cara y vínculo a la pantalla. Así que la agenda de hoy va a estar basada en poder conocer nuevamente experiencias en distintas partes del mundo que van a fortalecer el trabajo de prevención basada en evidencia que hemos venido desarrollando durante todo este tiempo. Y esperamos tener algún minuto o un par de minutos para conversar y las preguntas que sean necesarios. Y al final de la sesión les vamos a contar también qué vamos a preparar para la sesión de agosto, de qué se va a tratar hablar de monitoreo y evaluación, tal como dijo Brian, ¿no? Vamos a partir con, perdón si no pronuncio bien, un video de iPrep, que es una plataforma interactiva para el desarrollo de iniciativas de prevención en la escuela. Y vamos a escuchar a Mikhail Miovsky, perdón la pronunciación, de la Facultad de Medicina de la Universidad de Charles. Si nos pueden ayudar con esa presentación.
Ladies and gentlemen, thank you for this opportunity to speak about case study from the Czech Republic focus on school and community-based prevention, and thanks so much to you, Bill, for your kind and restless support. So let's start. Why prevention is such a challenging topic? It's pretty easy to answer it because it's about very different mix of theoretical perspectives, very different kind of interventions. We are trying to communicate and collaborate between very different institutional structures. So it practically means that in reality, prevention is it's not easy to build the system and to support the system. What exactly is prevention infrastructure? Infrastructure is everything what you need for high quality and professional and safe prevention for your kids and communities. It means that it's about service providers, it's about interventions, what they use, it's about workforce and their education and professionality. It's about prevention theory and methodology. It's about quality standards, competency models, certifications, accreditations, things like that. It's also about monitoring and evaluation and about academic sphere and research. What we did is a story how we built step by step, component by component, entire system for Czech schools and communities. And at the beginning, we found that we have almost nothing what we need for a real enough quality and professional prevention in schools. So we used different projects and public sources and built step-by-step entire system. And at the beginning, of course, what a robust national need assessment report and study, where we found that really we need everything to do and everything develop for our country. So as I mentioned, we use different sources and different projects, and we develop a theoretical level and theoretical framework. We develop different interventions and adapted different interventions from other European countries. And we also created recommended curriculum for schools and communities, and we also developed quality assurance system. From structural perspective, I can summarize it that it was about theory and definitions, how to do and what is needed to do. It was about particle curricula, and we tried to follow different needs in communities and define different curricula and offer different real interventions. And we also develop a comprehensive quality assurance system, including quality standards, certification system, and competency model for prevention professionals. From another perspective, we can define what we did and what we created for Czech schools and communities from another perspective, because at the beginning, our Czech schools strictly rejected to build system only for addiction prevention. It means they told us, sorry guys, we have also bullying a problem, we have also a sexual behavior problem, and we need to support sexual health. So we created comprehensive system and use the concept risky behavior and mix different perspective in prevention together and create one system. This system has 3 levels. The first is healthy and safety school. The second is focus on self-management and social skills. And the third level is focused on specific kind of risk behaviors with specific interventions addressing to this different risk and different problems for kids and communities. So after 20 years, we have decided that we need to move forward, and just one way approach and communication is not enough and not enough effective. So the decision was to develop something what is more interactive, and we digitalize entire system and all components and created iPref. iPref system is the answer to really tricky questions, because we found that we need to empower regions and promote community principles instead of centralized perspective and centralized approach. We needed to find a way how to balance different stakeholders' rules and activities and priorities, of course. And we also needed to take lesson that diversity is not weakness. It's well functioning and well running in nature. So there is no reason why I don't believe in diversity also in prevention. And the natural solution was to create an interactive system based on collaborative principles. What it really means in practice. We are trying to collaborate and support local teams, and iPref team plays a role of moderator and supporter, not expert level and delivering expert knowledge and experiences to the local level. It's just about moderating and supporting these people. The core principle of work is based on collaborative learning. We are trying to link different teams, different institutions, and support exchange of experiences and This is the last principle, sharing economy, because we have a limited public and private sources, and it is contrasting with need of high number of different interventions and local teams. It means that without sharing of experiences, without sharing interventions, there is no possible to move forward. So IPREF has three core components. The first component is represented by National Data Bank of Prevention Interventions. It means that people can find prevention professionals from school or communities. They can find what kind of interventions are available and for what. If they need training, if they need to pay for the intervention, and how difficult it is to implement the intervention. The second component is focus on education and training. It means that we have online trainings, we have face-to-face trainings, and we are trying to offer the best what we have, and for a reasonable money. I mean that we are trying to support public projects and projects with higher quality. The third level is focus on quality standards, evaluation, and quality assurance system. It includes also national monitoring system. It practically means that schools and communities are reporting what they do with providers and what they are providing in reality every day, every week, every month. It practically means that we have highly quality data from regions about number of interventions and number of hours what kids are receiving from service providers. This is homepage of IPREF system, where people can download all materials and can connect other teams. And the system is relatively very complicated and complex, and we needed partners. So you can see our partners for running, and it's a public service. It means that we are not charging people for using the system, and we are trying to do it as a public service. And Charles University is the leading body for this team or institutional team. And our partner is Czech Ministry of Education and Czech Schools Inspectorate, what is responsible for quality and safety in schools. I'm sorry. What to say at the end of my presentation, that I think that it's not just proclamation, and I'm really serious that prevention is highly technical activity requiring clear rules, professionalism and support from both central and local governments. But it practically means that one-way approaches and just expertness delivering knowledge, skills and competencies, that's not enough. We are trying to engage people and trying to link people from different regions and different schools. So digital system is something what is up to date, something what is available, technically available and financially, economically available. And I strongly believe that it's something where prevention infrastructure can be can make sense at the national level with reasonable money, how to run the system and how to be enough effective. Thanks so much for this opportunity again, and have a good day, and I really looking forward to meet you personally, and thanks so much.
Thank you so much, Michael. This was really interesting, and you seem to have a very sophisticated system of prevention, and I'm sure that there are a number of questions that people hopefully will have time for at the end of our session today. Our next speaker is Dr. and I apologize if I'm not saying it right, Rukaya Akel Al-Bastaki, from the Drug Department as Director of Ministry of Health Prevention in the United Arab Emirates. And Dr. Ruka, you can easily challenged me by pronouncing some of the Icelandic names. So, do we have a recording from Dr.?
Yes, we do have a recording. That recording is about to play. Thank you very much.
Thank you.
Dear esteemed colleagues and partners, I'd like to welcome you for this session on strengthening and expanding evidence-based prevention activities in United Arab Emirates. With you, I'm Ruqayya Al-Bastaki, Director of Drug Department in Ministry of Health and Prevention. In today's session, I'd like to highlight that Interpol statement from Tim Morris, the Executive Director for Police Services, that the supply of illicit drugs everywhere around the globe is more abundant, more sophisticated, and more diverse than it has been before, and that the non-medical use of prescription drugs is becoming a major threat around the world. Well, I'd like to highlight this pivotal gathering where we unite under a common cause, the global fight against the proliferation of synthetic narcotics, the threats of growing supply and sophistication of artificial drug markets, which now operate on an industrial huge scale. The coalition stands at the forefront of this battle, advocating for robust monitoring systems, public health-centered policies, and innovative preventive strategies. Well, I believe that together we can disassemble the complex networks that fuel the synthetic drug trade and to reduce the demand through education and support services. We look forward to a productive session. In the United Arab Emirates, we have the efforts is well established in combating drug misuse, which focuses on 5 pillars. The first pillar is the cooperation with all national and international authorities. In United Arab Emirates, we do inspect and control all of the pharmaceutical facilities and healthcare facilities in the using the electronic platform. We do monitor the prescription and the dispensing of narcotics and psychotropics in the licensed facilities, whether it's pharmaceutical facilities, ranging from pharmacies and medical stores, or through the healthcare facilities, hospitals and clinics, which are dispensing those categories of medications. Through Ministry of Health and Prevention, we are regulating the importation and exportation of narcotics, psychotropics, and precursor chemicals. And finally, which is the most important pillar, is the review and update the narcotics, psychotropics, and precursor chemicals schedules. In the United Arab Emirates, we have unified electronic platform for prescribing and dispensing the narcotics, the controlled and semi-controlled medicine. And this comes in close collaboration with our strategic partner Ministry of Interior. Based on Ministerial Decree number 379 of the year 2019 regarding the unified electronic platform for prescribing and dispensing narcotics, controlled and semi-controlled medicine, a unified electronic platform was established to monitor the prescribing and dispensing of narcotic, controlled and semi-controlled medicine, with the aim of unifying and governing the procedure for prescribing through the doctors and dispensing through the pharmacies of these medicines in licensed healthcare facilities in the country, and enable the concerned health authorities of controlling, auditing, and monitoring the prescriptions electronically to reduce the misuse and control malpractices. In addition to that, Ministry of Health and Prevention has created the Narcotic and Precursor Chemicals Smart Directory, and the SMART application was launched in December 2020 based on recommendations from the Narcotic and Psychotropic Schedule Review Committee to facilitate the search for the regulators, law enforcement agencies, in addition to the pharmaceutical establishment and healthcare providers. So we have the substance listed in Narcotics and Psychotropic Schedule attached to the Federal Law number 30 of the year 2021 regarding combating narcotic drugs and psychotropic substances. We have the list of registered narcotics and psychotropic medicines in Ministry of Health and Prevention. We have the list of precursor chemicals and surveillance chemicals listed in INCB tables, and the related laws in the United Arab Emirates. And this is part of the electronic transformation and providing the flexibility for our strategic partners to go through the list and explore further the mode of dispensation of such a registered medication, as well as the precursor chemicals. Ministry of Health and Prevention is chairing two important committees. One committee is for reviewing the narcotics and psychotropic schedules, and that is based on the Decree Law number 30 of 2021 regarding combating narcotic drugs and psychotropic substances. And according to Article 4 of the Decree Law, with the membership and representation from Ministry of Interior and other internal health-related authorities and police departments. In 2012, 8 substances were added. In 2015, 161 substances were added. In 2019, 84 substances were added. In 2021, 33 substances were added to the schedules of narcotics and psychotropic schedules. Pertaining to the second committee, which is the precursor chemicals, Ministry of Health and Prevention chairs that committee based on the Federal Law number 8 of the year 2019. And we have a membership from representative from Ministry of Interior and other internal stakeholders. In 2021, 4 precursor chemicals were added, and in 2023, 4 chemical precursors were added. For regulating and controlling the import and export of precursors and surveillance chemicals, Ministry of Health and Prevention had to develop this electronic integrated system to ensure the legality of its use in collaboration with Ministry of Interior, in addition to verifying the safety of storing these chemicals in MOHAB registered medical stores. Ministry of Health and Prevention and Ministry of Interior are obligated to receive and enter the required information about the company, the chemical precursors, and the quantities through the electronic system of the International Narcotic Control Board, the PEN Online. for regulating and controlling the import and export of narcotics and psychotropics. We have this complete system with our partner in Ministry of Interior to import the narcotics and psychotropics and issue the necessary approval through the electronic system for our licensed drugstore and ensure that all standards of quality and safety of medical products are met, in addition to the legality of using medications in facilities which are licensed by our healthcare system, and in addition to that, obtaining authorizations and approvals through the I2E system that is launched by International Narcotic Control Board. So this is in brief the efforts being put together in Ministry of Health and Prevention in collaboration with the international stakeholders, in addition to our local health authorities and Ministry of Interiors. If you have any further inquiries on sharing the controlled chemicals email, controlledchemicals@mohab.gov.ae. If you have any further inquiries in relation to the above mentioned topics. And thank you so much.
Muchas gracias a la doctora Rucaya. Sin duda es un tema muy interesante, ¿no? Porque hemos estado hablando todo este tiempo de el fortalecimiento de las comunidades, el fortalecimiento de factores protectores, pero no podemos olvidar que cualquier esfuerzo que hagamos respecto del abordaje de los consumos de sustancias tienen que guardar el equilibrio entre el desarrollo de factores protectores, pero también la disminución de factores de riesgo, ¿no? Y tener un sistema de monitoreo de los medicamentos que se están utilizando sin receta médica es también una perspectiva de disminuir factores de riesgo. Así que es una experiencia muy, muy interesante en la lógica de sistema de trabajo para abordar los problemas de consumo en cualquiera de sus niveles. Por último, vamos a conocer la experiencia de Sierra Leona, en donde el profesor Fodai Sarr, perdona la pronunciación, que es director ejecutivo de la Agencia de Salud Pública de Sierra Leona, nos van a comentar cómo es que abordan esta temática en su país.
Good morning, colleagues. I am Professor Fodai Sarr, the National Coordinator for the National Task Force on Drug and Substance Abuse in Sierra Leone. In Sierra Leone, a significant rise in mental health and substance abuse cases was observed between 2020 and 2023. Advocacy Mental Hospital, a rise of over 1,200% in substance abuse cases was observed between 2020 and 2023. And for Kush in particular, which is a synthetic drug that is currently being identified as being misused in Sierra Leone, over 3,800% surge in Kush admissions were observed during the same period. This trend informed the decision of the government of Sierra Leone to establish the National Task Force on Drug and Substance Abuse. Since my appointment as National Coordinator of the Task Force in on April 9th, I would like to provide an update of what we have done and where we want to go. Following guidance from the Presidential Advisory Committee, the National Task Force has established a lean and robust response structure. We have conducted a rapid scoping mission across all 16 districts in the country to engage district leaders and to understand the magnitude of the kush problem at community level. The goals of the response are 5. The first one is we want to reach 70% of communities nationwide with communications and community engagement interventions within the first 1 year. Number 2, we want to reduce youth drug abuse by 80% within the first 2 years. Number 3, we want to establish at least one facility-based center for severe cases and community-based therapy for mild cases at district level within the first 1 year. And the fourth goal is to support 70% of individuals to return to work or education within a year of treatment. And the last one is to reduce the availability of kush by 80% within 1 year. What is our response structure? The National Task Force response structure leverages expertise across various government agencies, including the Presidential Advisory Committee, the National Coordination Team with a 24/7 situation room at the National Public Health Agency. We have 5 response pillars led by relevant government ministries, departments, and agencies. And we have district leadership in all 16 districts. What is our strategic approach? The task force aligns with the 5-pronged strategic approach outlined by His Excellency the President. And that is 1, we want it to be cost effective. It has to be data driven. It focuses on capacity building of existing structures and emphasizes community ownership and sustainability. The response of the task force utilizes comprehensive continuum of prevention and care approach, encompassing identification of kush users, treatment, recovery, and reintegration. As stated earlier, the response has 5 pillars, and these are 1, public information and risk communication. This pillar is led by the Ministry of Information and Civic Education and co-led by the Ministry of Health. That is the Health Education Department in the Ministry of Health. This pillar is responsible for the conduct of nationwide campaigns to increase access to accurate information on the dangers of using kush. The second pillar is community engagement pillar, and this pillar is led by the Ministry of Local Government and Community Affairs and co-led by the Ministry of Health. This pillar is responsible for the engagement of community leaders and groups in designing and delivering response activities and to gather and channel community feedback to inform all areas of the response. The third pillar is care and treatment. This pillar is led by the Ministry of Health and co-led by the Ministry of Social Welfare. This pillar ensures the availability of treatment programs for substance use disorders, and we conduct testing to identify active ingredients of kush and monitor usage patterns. The fourth pillar is the rehabilitation and reintegration pillar, and this pillar is actually led by the Ministry of Social Welfare, co-led by the Ministry of Youth Affairs and Ministry of Technical and Higher Education. This pillar will provide a comprehensive recovery support, including nutrition, counseling, skills training, and reintegration. And the fifth pillar is the law enforcement and border control. This pillar is led by the National Drug and Law Enforcement Agency, co-led by the Sierra Leone Police and the Republic of Sierra Leone Armed Forces. The function of this pillar is mainly to disrupt the illicit drug supply chain through investigations, arrests, and prosecutions, as well as providing operational support to other pillars. The response, as I stated earlier, is decentralized. We are ensuring that we have district leadership. The district level response is led by and coordinated by the district council chairpersons or mayors, and then co-led by the district medical officers. Notwithstanding, the same structure that we have within Freetown is what is replicated in the districts. That is, all the ministries and agencies are represented in the district task force. What have we done so far? Since the establishment of the task force, we have embarked on one national campaign. We have disseminated accurate information on Kush, its dangers, and available resources. We have the campaign has targeted frontline responders, families, and young people. And we have established treatment centers. We have started with Freetown. In Freetown here, we have 120-bed facility at Hastings. We have a 30-bed facility at Kisi Psychiatric Hospital, which can be extended to 50 beds. We have 20 beds at the police hospital and 15 beds at the 34 military hospital. In the next couple of weeks, we intend to commission 3 regional centers, one in Daru, which is in the eastern part of the country, one in Gundama, which is in the Bo district, in the southern part of the country, and one in Bombali Makini, which is in the north of Sierra Leone. The post-treatment opportunities, we have mapped and we intend to secure resources for those that will be going through the rehabilitation process so that they can be properly reintegrated. This is a government commitment, and the Ministry of Technical Education is working closely with the Ministry of Youth Affairs, the Ministry of Labor, and the Ministry of Social Welfare to make sure that these people are properly reintegrated into society, and those who want to go back to school can go back to school. Because we observed that in this last discharge of 116 victims that we discharged from the treatment center, about 52% of them were university graduates, were university students. So we are encouraging them to make sure that they go back to university and continue their programs. And the fourth activity is strengthening drug control laws. We are advocating for a review of the current national drug control laws. We are collaborating with the Attorney General's office to address this issue, because if you look at the charges and fines for people who actually are found wanting with selling drugs, the fines are ridiculous. So we want to propose more punitive measures and more strict fines so that people can be held accountable. Partner support. Partners both within the country and outside Sierra Leone have been very supportive. In a recent visit by the Minister of Health and myself to the US CDC and the State Department of Health yielded positive responses. We actually secured commitments from our colleagues to help us in assessing the magnitude of the problem, that is who is affected and where they are located. They also made a commitment in providing a rapid testing strips, also in providing us with educational materials, and they also made a commitment to ship samples to the US to determine the composition of the kush and eventually to support Sierra Leone to establish a drug testing laboratory in country. Whilst we are waiting on that, the government has been working with other partners, and we have collected some samples of this kush. Preliminary analysis have been done here, and it was found that the substance identified as kush in Sierra Leone contains a synthetic cannabinoid and a drug called nitazene. Nitazene is a drug that was manufactured in the 40s and 50s, and but was not put in the market. According to data, it is 100 times more potent than heroin and 10 times more potent than fentanyl. These samples are now going to be shipped to a laboratory in Spain for confirmatory analysis. So we want all partners to come on board, and we are ready to collaborate with partners both within and outside the country. In conclusion, ladies and gentlemen, together we can address the challenge of drug and substance abuse and build a better future for Sierra Leone. I thank you.
Thank you so much, Professor Saad. I am always so impressed when I listen to people from around the world, how we are in line with what we're doing, how people are optimistic in their work and in using evidence. And I give you an example. When we started out in Iceland in 1997, we called the program Iceland Without Drugs in 2002. And people laughed at us and said, this is never going to happen. And we didn't make it before 2002, but guess what? We are now facing generations that are not using any alcohol. So the higher the level of the aim, the better. So I'm sure all these three presentations have been so interesting. I'm sure that we have a lot of questions. As always, we have too little time, but first I want to give the word before we open up the floor to my colleague Carolina.
Gracias, Inga. Sí, tal como mencionaba Inga ahora, la sesión de hoy día nos mostró la importancia de mirar el abordaje del consumo de sustancias en sus distintos niveles como un sistema integrado, ¿no? Como la perspectiva que debe incluir tanto la prevención, el tratamiento, la recuperación y el equilibrio entre acciones de reducción de la demanda y reducción de la oferta también, ¿no? Y cómo los países debemos mirar este sistema, cualificando también cuál es la oferta que tenemos en este sentido. ¿Con qué contamos en prevención? ¿Con qué contamos en tratamiento? ¿Con qué contamos en recuperación? Y cómo se produce la articulación entre distintos organizaciones tanto del Estado como de la sociedad civil. Y entonces cómo vamos empoderando a las comunidades, a las personas, para poder acceder a estos servicios y demandar también los servicios que son requeridos de acuerdo al nivel de desarrollo que tenemos en cada uno de estos ámbitos en nuestros países. Estaba solicitando la palabra Mariano y Camila, nos quedan 5 minutos.
Gracias.
Así que, Mariano.
Gracias, Carolina. Gracias, Ingadora. Gracias a los presentadores. Quizás dos...